Welcome to Healing the Tigress, a podcast of conversations and stories on Asian American Pacific Islander maternal mental health. We are your hosts. I'm Peggy, a perinatal mental health therapist.
And I'm Jasmine, a clinical pharmacist who is perinatal mental health certified. Both of us are Taiwanese American mothers who have lived experiences of postpartum depression and anxiety. It felt like we didn't see anyone who looked like us also struggling with their mental health in new motherhood. But we would go on to learn that it wasn't just us and that there was so much more to perinatal mental health.
So we created this podcast because we know that sharing these stories can begin to break the stigma of mental health in our community, and we want to help heal the inner tigress in all AAPI parents. Let's get started. Hello, Healing the Tigress fam. Before we begin our episode today, we wanted to remind you that the information provided in this episode is not medical advice, and you should always consult with a professional who knows your history first. We also wanted to let you know that this will be the last episode of the year before we take a little winter break. However, if you're a subscriber, you will get one more bonus episode before the end of the year. We will resume the podcast again sometime in January 2026, so check out our subscriptions if you want to catch up on some bonus episodes in the meanwhile. And don't forget to follow us on Instagram for the latest updates. Happy holidays! Now on to today's show.
Hi, friends. In our first season, we were lucky to have the pleasure to interview reproductive psychiatrist Dr. Nia Dond in episode 17. Her episode was really helpful in debunking myths on some of the psychiatric medications during the perinatal period and the risks versus benefits of medications. And we wanted to continue discussing other medications, particularly maybe for anxiety and sleep during this perinatal period. So we are really grateful to be able to have another reproductive psychiatrist on our show today, Dr. Kristen Lasseter.
Thank you so much for having me.
Dr. Kristen Young Lasseter is a board-certified psychiatrist based in Texas who specializes in reproductive psychiatry and women's mental health. She's the founder and president of Reproductive Psychiatry and Counseling, which hosts multiple psychiatrists and psychotherapists specializing in mental health across the reproductive lifespan and treats people across the state of Texas. Dr. Lasseter is also affiliate faculty at the University of Texas Dell Medical School, Department of Psychiatry and Behavioral Sciences, and is a board member of the International Society of Reproductive Psychiatry. She volunteers time at Postpartum Support International's Psychiatric Consult Line and raises awareness about reproductive mental health through speaking engagements and social media.
Thank you so much, Dr. Lasseter, for being here with us today to talk about your own story, as well as answer some of the clinical questions we have about certain perinatal psychiatric conditions and medications. Would you please just start us off by telling us a little bit about your cultural background and where you are in your motherhood journey right now?
Yes, so I am half Chinese. My father actually was born in Hong Kong and moved here when he was 5 years old. And my mother is Caucasian. She was born in Syracuse, New York. And so I get the benefit of being from both cultural backgrounds. And in terms of my motherhood journey, my children are now they're 9 and 10 years old. They're pretty close in age. And I feel like I'm finally through the hump of maybe the hard part. Although I heard that teens, especially with girls, can be rough. So, maybe I'm entering another hard part. I'm not sure.
There's so many firsts. I feel like we're always learning as we're going on the go because no one really knows what they're doing till they get there. So, yeah.
Yeah. You mentioned that you were pregnant with your first child during your second year of psychiatric residency, and at the time you were already planning to specialize in women's mental health. How did that passion begin, and how did it grow even bigger as you entered motherhood yourself?
I originally went into medical school thinking that I wanted to do OB-GYN because during the time between medical school and college, I had worked for an obstetric and gynecologist office as a medical assistant, and I just loved working with those patients, and it was just felt like, I don't know, just a special thing to kind of be able to interact with women and have them as your patients and kind of go through this special time with them with pregnancy and postpartum and then life in general. And so going into medical school, I was almost positive that's what I wanted to do. And I actually put psychiatry at the end of my clinical rotations because I was like, that would be the last thing that I actually end up doing. And then when I went through psychiatry, my psychiatry rotation in my third year of med school, I absolutely loved it. I was not expecting that, but it was just so fascinating to me. And I felt like it was even more meaningful in terms of how you get to interact with patients and the stories you get to hear and the way you get to help them. And so when I went into residency interviews, I didn't know that women's mental health or reproductive psychiatry was even a thing because it really wasn't in Texas. But when I was interviewing at residency programs in the Northeast and on the West Coast, it was a typical part of their residency programs. And I just thought, oh, this is perfect. It's like marrying obstetric and gynecology with psychiatry, and I kind of get the best of both worlds. So that's originally what had me wanting to go into it. But then after I went through my experience with postpartum and pregnancy, I think I realized even more how important it is. I ended up having postpartum anxiety and I did not expect to have that. And it was just, I don't know, it was so important to have people in my corner who would tell me like it's okay to take this medication and providing reassurance. And it made me realize that doing that for work can really be touching in both the patient's life, but also you're impacting the child and their development too.
Yeah, I think also like before you really become a mother, it's kind of hard to really know what it feels like on that side. And when you are in the shoes of the patient and you're the one experiencing it, as well as being recommended like a medication, right? Even if you are a provider yourself and you've learned everything in school about the risks and benefits and side effects. I mean, I felt a resonance when you were explaining that in your pre-interview story. I myself also, even as a pharmacist, was like, when it comes to me being the one taking it, it just felt so much bigger and scarier to follow my own advice that I would recommend this to somebody. But when it came down to myself, for some reason, it felt scarier or more real. So, what were you maybe the most nervous about? I mean, I think you've been pretty open about starting medication yourself during this time when you had the postpartum anxiety. What was the thing you were most nervous about when it came to starting something? And then, like, what finally convinced you to try it?
I think I was probably like most moms, most nervous about causing harm to my baby with the medication and like, what is this going to do to my baby? And will she have side effects? Will there be issues? Which is funny because I knew all of that information. I had all of the facts anyways, but it was still this real fear that was was looming over me. And I think being able to recognize that other people saw how much I was suffering and how much this was impacting me and just our family in general. That was helpful for me to realize, like, obviously, this isn't just impacting me. So it has to be impacting my baby too, even if I feel like I can hide it. And so I felt like overall, like me being in a good place and feeling better was probably what was best for her and causing the least harm to her too.
Yeah, that's a beautiful way to sort of think about it and summarize that. And how long, if you don't mind me asking, did it take for you to actually see that the medication was working? And was it what you had expected based on your clinical experience?
Want to say it took a good like 3 or 4 weeks to start noticing an effect for me. And then, even then, I want to say the dose I had started out at was just kind of partially effective, and it wasn't necessarily like taking away everything, all of the symptoms for me. So then that ended up taking more time with needing to increase the dose of the medicine. But it did feel I mean, luckily for me, I didn't have side effects with the medication. And it did honestly just feel like, okay, like I'm back to normal. Like I feel back to myself again. And like this weight had been lifted in terms of all of the anxiety and stress and tension that had been going on. So it just kind of made it feel like okay, I'm me again.
Yeah, I feel like a lot of people have that same worry in postpartum with, is this medication going to impact my baby, especially if they're breastfeeding or when they're pregnant, because you're like, if I take this while I'm pregnant, what's going to happen? Especially when we're thinking about antidepressants. And we know, and you know as well from studies, that antidepressants are the most studied medications when it comes to lactation, and that the relative infant doses are low and safe. And we talked about this in episode with Dr. Nia Dond. But we'd love for you to maybe go a little bit deeper with us again of dispelling some of those breastfeeding and antidepressant myths, either from your personal experience or what you've seen in practice.
I think looking back, you hear people expressing like their concerns about the medication and not wanting to cause harm to their baby, and looking at it from a very objective standpoint and kind of being the provider, the one who's outside of their personal life. It's easy to see, well, like you are suffering a lot, and we know like your mental illness has these negative effects on the pregnancy, on the fetal development, on baby's development when they're an infant. And so it's so obvious to me, like, the effects that the illness is having is so much riskier than the effects that the medication has. And here are the facts. But when you're actually in it, I think then it can be really like emotional, and kind of that fear, I think, overrides that part of your brain that is more logical and can think through those facts. And so it feels like, oh, but this doesn't feel right. This doesn't feel like what I'm supposed to do. It feels better than I should not take this medication and not subject my baby to those risks. But I think then it's important really to educate people about the risks of the mental illness just as much as it is to educate them about the risks of the medication, because I think a lot of times people miss out on that portion of it when they're thinking through whether or not to start a medication. But to answer your question, with antidepressants, especially in pregnancy, we have so much research now on the SSRI medications, especially like the old traditional ones, that we can pretty confidently say that there are very few risks associated with these medications. And a lot of the things that come out in research, it ends up being that we can actually attribute that to the mental illness and to probably more like genetics related to the mental illness than actually to the medication. So there's been claims that antidepressants are linked to autism. We see that actually that's more linked to depression. And when you can mess with the data so that you're playing with statistics where you can kind of pull out the risk of mental illness, you actually see that that risk isn't there anymore with the medication. And so the thing that has been, I think, repeatedly shown with these medications is the risk of neonatal adaptation syndrome. But what I like to explain to my patients is this is a, time limited condition that can happen with babies, and the majority of babies don't experience it. And then the babies who do, the vast majority of them don't have any kind of complications from it. They don't even need treatment for it. The treatment is just more skin to skin, breastfeeding, cuddles, more natural ways of helping your baby's nervous system. And so I think that that's a pretty good trade off in terms of like the risks that can come along with the mental illness.
Yeah. I feel like the rhetoric around medications and breastfeeding or pregnancy, it's either women have to just tough it out and don't take a single thing, or women are the cause and the problem of everything that's happening to their babies. And there's no like in between. It's either you're the problem or you just have to tough it out. And it's what's driving a lot of the stigma of taking medications when you need it.
Like, don't even take Tylenol anymore, right? Just tough it out. I
Right.
mean,
Just tough it out.
It's not that hard.
Yeah, this is why I feel
Yeah.
like we need more perinatal specialists. We need more people with this type of reproductive knowledge, even outside of these fields. I think back to a time when my baby was close to like 12 months, 11 months, and I was at an appointment for the baby, and a medical student just happened to be there. No fault of his own, but he was like, "Oh, have you considered weaning? Are you ready? You should probably start weaning." And in my head, I was thinking, sir, you don't know a thing about perinatal health at all. And who are you to tell me that I should start weaning and for what reason? And so as we think about reproductive psychiatry, it seems to be a more specialized field. But do you think, like in my example, that there is a lack in cross education about risks and benefits of medications along with breastfeeding safety in these other fields, where there may be points of interaction of a pregnant or postpartum woman, like in my example? What can be done to increase education or awareness in our siloed medical fields?
There's definitely a gap in education around that. When I was going through residency training, I mean, granted, it was in Texas, but it was still at a reputable institution. There was no training on medications in pregnancy and medications in breastfeeding. All of that was, something we had to kind of learn on our own. And then when you talk with obstetric and gynecology professionals, most of them did not get any training on psychiatric medications. And so there's kind of this gap where people fall in terms of needing psychiatric care while they're pregnant, and neither field really having that expertise or training and education in it. I think in recent years, especially in the last 5 to 10 years, I feel like that's gotten a lot better. I think there's been a big push for people to have more education around perinatal mental illness and around the fact that, okay, the mental illness itself might actually be worse for people than the medication. And there's also something called the National Curriculum of Reproductive Psychiatry that was formed a few years ago that people, I think it's free for residents and other providers, but they can actually get trained on reproductive psychiatry from people who, have been experts in the field. And I think that's helped to kind of spread a lot of more accurate information for providers.
Yeah, I feel like a lot of times in the medical field, a lot of it becomes like, well, this is not my specialty, so it's not my problem. And pregnancy, pediatrics, like certain populations, we kind of group them as like, ooh, that's special. Like I think my courses in pharmacy school was like, this is special populations. And you kind of just like, I don't want to touch that. I'll send it to the specialist, right? And it doesn't even have to be pregnancy or pediatrics. It could even just be like, somebody being like, ooh, that's cardiology's problem. Let them go read that, CT or that X-ray. I don't want to deal with that kind of thing. And it becomes a very lot of like push shove kind of thing. But I do kind of wish there was a more holistic, like integrative kind of thing. And to your point of like medical doctors in training only get what, like 1 or 2 semesters of medication training. I mean, that's probably why there's a whole separate doctorate program for pharmacists. But at the same time, like that is a very big part of your job, is to talk about and prescribe these medications. So I have heard though that, like, with the OB-GYN specialist and their route, that their focus can't, I guess, the time that they have with the patients, like they're not dedicated to figuring out the mental health aspects. And yet I feel like that's a huge part of your postpartum care. And maybe if postpartum care was a little bit more linked to OB-GYN, we would have more push or more urge to learn more about these kinds of things. But you get one visit and it's like, you're cleared to go do it. Yay. But I feel like so bad. But that's not my problem. So I mean, our medical system is a little bit broken in that sense, but I do feel that like as we talk more about it, then there becomes this urgency of like we do need to treat the patient as a whole. Like it's not just like now the baby's out, we're done. There's other parts that we have to think about. Just like, how this country doesn't support moms once the baby's here. It's like have more kids, but we don't want to help you with it. Good luck.
Hmm.
Yeah. Well, and I'm going to switch gears just a bit to talk a little bit more about some clinical things. But you mentioned having that postpartum anxiety that really sort of caught you off guard, and I do feel like a lot of women actually have postpartum anxiety, kind of hand in hand with postpartum depression. We may not educate people on postpartum anxiety as much, and I've spoken with moms who've asked me for advice because they think they have postpartum anxiety maybe, but not depression. They'll be like very clear, like I don't have depression. So a lot of them are torn about like, I don't need to start an antidepressant then. I don't need to start a medication. I just have anxiety. I don't have depression. I'm not sad. And I don't think it's because they think that they shouldn't be taking an antidepressant to treat their anxiety. What can you maybe tell us about teasing out pure postpartum anxiety from postpartum depression? Like, can you even do that? And what does the treatment plan look like? Like, how does that look when in regards to medications or not?
So they are two separate things and they can be teased out, but a lot of times they go together. Like a lot of people with depression also have anxiety and vice versa. The disappointing thing with our research in perinatal mental health isn't there's really not a lot of information on postpartum anxiety. And so we don't have as much of the, numbers that we can kind of spout off that we do with postpartum depression. And it's not recognized in like the DSM, what we use to kind of diagnose psychiatric diseases and illnesses. We don't have a, postpartum anxiety diagnosis. And so it kind of falls into this like abyss of like, well, I think it's like anxiety, but it doesn't really even fall into what we would classify as generalized anxiety because for a lot of people, that has to be there for 6 months before you can make that diagnosis. But in regards to diagnosing it in pregnancy and postpartum, we kind of go along with the same criteria other than the time criteria. And so, really people having just feeling anxious, a significant portion of the time, usually it's, most of the days they're feeling pretty anxious. They're having a lot of trouble kind of controlling that worry, or they're just having a lot of like excessive worries where they're, kind of like, I don't even know why I'm worrying about that still, having muscle tension or just feeling tense, feeling on edge, feeling restless. In the postpartum period, it often looks like not being able to sleep even though the baby's sleeping. So baby will be sound asleep and for some reason your mind just cannot shut off to go to sleep. And for a lot of people they don't feel depressed with postpartum anxiety. It's, they feel fine. They're happy, they're able to enjoy their baby, they feel a good bond with their baby, but it's just feeling really anxious. And we don't have as much research showing what effects that might have on child's development, but from the research we do have and from what we can extrapolate from other mental health disorders, it's definitely affecting the kids' development and, their mental health development, their brain development, their physical development. And so treating it, I think, is really important. But for anxiety, just like with depression, therapy can be a really important piece of treatment. And when you're having more mild symptoms, that might be even the first line treatment. But otherwise, you still use antidepressants to treat anxiety. I think they're originally called antidepressants because that's what I think they were originally FDA approved for. But they actually treat anxiety just as well, if not better, than depression. And sometimes we need higher doses of those medications to actually treat anxiety than we do for depression, but they're still just as effective. Also, with postpartum depression, there is a significant portion of people who actually have bipolar disorder. And so their depression, even though it's presenting as depression, it's not treated with antidepressants, or antidepressants might actually make them feel worse. And what they really need is like a mood stabilizer or something that's targeting more of like the bipolar disorder rather than depression per se.
What would you say for someone who is like in therapy for their postpartum anxiety and they are really still struggling, even though they're consistently going to therapy? What do you feel like is kind of the cutoff for having a discussion about medication? And I know it might be unique to every person, but I'm just curious your general thought on that.
Yeah, in general, I feel like if you've been in therapy for a good like month to 3 months and you're still not getting better or not getting better enough to the point where symptoms are minimal and they're not bothering you or bothering other people, then I think medication needs to be something that's discussed. For a good portion of people, even if they have mild symptoms, for some people, therapy just isn't effective at treating those symptoms by itself, and you need medication also. And similarly with medication, like for some people, the medication by itself isn't enough to treat their symptoms, and they need therapy also. And what we repeatedly see just with mental illness in general is that pairing medication and therapy together usually gives you the best outcome in terms of being able to get the, biggest remission of symptoms, and for that to actually last too.
Yeah. I think that all the stuff that you just said about the anxiety, the depression, the not sleeping, like, I'm like, oh, she's talking about me. Like, that was like, I, I had all that mixed together because I had terrible insomnia. I couldn't sleep. So I literally had, I feel like it, the doctor that was describing is like, we need to treat the anxiety. And the thing is, like, anxiety is one of the criteria or symptoms of depression too. So it's very like, can't tell what's causing what came first, what's worsening what. And that's probably why the antidepressant, quote, just this just the name, but the medicine does treat like both things. And to lower the anxiety could probably help you sleep, like in my case. And I think a big telltale sign for me, as you're describing the anxiety portion, besides for just like you can't really do your day to day as best or carry on as best as you can, it's impacting your daily life. I One of the things that really clicked for me when I was reading through and like learning about it was some people were describing where they would start to get these decision paralysis, and I was like, wow, that was, yes, that's I could totally recall when I would just be standing in the hallway hearing my baby cry and being like, okay, do I go do something or do I let her cry it out? Should I let her cry out? No, I should tend to her. No, I should not. And I literally couldn't even do anything. I would just be stuck there, even though I knew I had to make a choice. And then I would just sit down and not make a choice. So I think when you get to that like critical point where it's really affecting like your actions and what you can do, those might be signs that like the medication could help. And so I'm just throwing that out there in case people are still kind of like, okay, I need some more examples of what this might look like.
Yeah. Well, and that's a good point. I think one of the other pieces for a lot of people is it affects their concentration and their ability to focus. And so it's not uncommon that we'll have people show up who are like, I think I might have ADHD, but then you're getting into their other symptoms. And it's like, no, you just have really bad anxiety that, is also impacting your ability to concentrate and focus, and your mind's just kind of spinning out of control sometimes. And then irritability is a big one, especially in the postpartum period. That can be a big part of anxiety, is like that postpartum rage that people talk about. It can be a symptom of depression, but that can also be one of the symptoms of anxiety without the depression.
It still blows my mind that the only diagnosis we can use is postpartum depression, and that there's so many other things going on, like the postpartum anxiety. And so often I'm like, okay, adjustment disorder with anxiety just doesn't cut it for me, but I always have to use that until they hit that 6 month mark. And I'm like, great, now you have generalized anxiety disorder, which also is not what I want to be using. But it just kind of hit a light bulb moment. Like, how are we going to know more about how to help moms if we don't have that data because we don't have the right labels? As much as I hate kind of calling it a label, but the only way we're going to know the difference is if we're calling it what it is, which is postpartum anxiety.
Right, you need like a standardized diagnosis and criteria to be able to say, okay, this is what we're studying and this is what we need more information about. And if we don't even have that, how do we even standardize it to study it? Like it's very frustrating.
And even with the other doctors, like they already don't know how to tease it out as much as like a specialist would. And if they don't even have the criteria to follow to diagnose, I can't imagine how much harder it is. And that's why they're just like, well, let me just push this to somebody who might know more because I don't even have like a standard or guideline to or recommendations I can even go off of, right? It's not my
Yeah.
field.
Yeah, they're not even screening for it. You know,
Mm-hmm.
the only screening tool that people really use is the EPDS, the one
Mm-hmm.
screening for depression. So it's
Well,
not
and like
even being
I didn't
screened
even
for.
get the EPDS. I got a PHQ-9, and when I was answering it in my OB doctor, I was like, "How am I supposed to answer these questions? Am I feeling? Am I anxious? Am I worried? Yes, I am worried. I'm worried. I'm not doing anything right. Like, am I sleeping? No, of course I'm not sleeping. I'm a new mom. Like, none of the questions made any sense how to answer. I'm like, I don't know if I'm answering this right. I think I'm gonna get a really bad score. Like, or I would have gotten a bad EPDS score, but this just didn't make any sense to answer. So, yeah.
Yeah.
I know that you mentioned therapy earlier, and curious if we can dive into a little bit of your personal experience before you had dealt with your postpartum anxiety and depression. Had you ever done therapy? And if so, or if not, has it changed how you practice or recommend treatment for your patients?
Before I even was pregnant, I had done therapy when I was in residency training. They had encouraged us to do therapy being psychiatry residents. And I totally understand that now, having gone through therapy and having, been a practicing psychiatrist. I feel like it's so helpful to kind of be able to have that personal insight and to also be able to understand your patients better. But I had probably been in therapy for a good like year and a half before I had my first child. So it was, unfortunately, that didn't prevent or help my experience with postpartum anxiety, but I definitely feel like I have been able to use a lot of tools from therapy to help when I'm feeling anxious.
And a small side question, because often when I talk to some clients about psychiatry referrals and whatnot, I know that some psychiatrists practice psychotherapy as well. Is that also an offering that you provide your patients?
Yes, I do psychotherapy with a few of my patients. I tend to stick more to the medication management. It's just more of a passion for me, but I also enjoy doing psychotherapy. But yeah, there's a lot of psychiatrists who do both and do a balance of both. And then I've even met some psychiatrists who don't prescribe medications. They've kind of, got more into the psychotherapy part of it and medications just aren't what they feel is the right choice anymore. And so, yeah, there can be either one.
Yeah. Well, I think it's also good to normalize that, you know, even if you had already tried therapy, that this is a different stage in your life that uses different kinds of tools that maybe you hadn't been exposed to before. And it's not a testament to saying, look, therapy doesn't work. Like she got it anyways. I think it's more to say, like, hey, you go through different seasons of your life and you need the therapy for different things that you're going to learn new tools and new skills as you enter this world that you've never been through. Like you can't possibly understand what it's like to be a mom until you are one. So I just want to point that out to any listeners that are like, on the fence about it. And especially since, our audience is a lot of Asian Americans who maybe this is their first time ever even thinking about going to therapy. Like for me, I never did therapy until I was, my doctor's like, you're having some, like, you need to go talk to somebody. And for me to like mentally go over that hurdle too, was like, no, I don't need that. Like, how am I going to talk my way out of this? So I think breaking down some of those stigmas and explaining more what it can do to you can be really helpful to our listeners and our community. Yeah.
Yeah, I always tell clients that it's as if in therapy, without the medication, if you're needing it, you're trying to do all these coping skills, but with this big cloud looming over you, and the medications help lift the cloud. You still have to do the work, but now at least the cloud is lifted, and now you can access the coping skills that you're learning.
Yeah.
Yeah, and I think even for depression, they've been able to do brain imaging showing that when people are doing therapy, like which part of their brain is changing versus when
Mm,
people are doing medication, which part of their brain. And it's actually that the different pieces are helping different parts of your brain. And then, it's probably putting those together that is why people get better when they do both.
yeah. Yeah. And then the other part I wanted to sort of talk about was the anxiety insomnia piece, because it's very chicken or egg. Like, what came first, right? Is anxiety making the sleep issue worse? Is the insomnia driving the anxiety? For me, I think it made my depression worse, because I thought I don't know, this was just a very irrational thought, but I thought I would never be able to sleep again. And I just thought something was very innately broken inside me. So, like, what am I going to do if I can't sleep? It's a very, very basic function. If I can't even do that, how am I supposed to mother? Like, how could I even be considered a good mother? And we know that CBTI, or cognitive behavioral therapy for insomnia, is the gold standard for treating insomnia. But I think there are like some women, and I know myself in that moment was just so desperate to get sleep soon. And I'm like, okay, well, how long is therapy going to take for me to get better? Like, I needed to sleep yesterday. Like, I'm so exhausted. I haven't slept for like 48, 72 hours. Like, that's just bordering on like the part where your brain's going to start going in the wrong direction. And so for women who are kind of desperate for that, do you have any like recommended medications for the sleep part during pregnancy or postpartum?
It really depends on each like individual kind of, what things have they tried before, what things have they already tried in the pregnancy. Like very commonly, people have taken doxylamine in the pregnancy as part of like diclegis or something else to kind of treat their nausea. And so that for a lot of people can work for sleep. And so if I have a patient who's already been taking that or they took it earlier in the pregnancy, then often that's like the first thing I go to, because then it's not like we're having to expose the baby to another new medication. But there's also, like magnesium glycinate over the counter can help people with sleep so that, it's more of like a natural supplement that they're already getting in their prenatal vitamin. But then outside of that, I can't stress enough how important it is to treat the underlying issue, like with the anxiety, and then doing something that has more research that has hopefully also been effective for the person before. Like hopefully you kind of know, okay, what has this person tried in the past that can be helpful for them, and which one of those things do we have more research on in pregnancy. And for a lot of people that ends up being, like benzodiazepine or one of the like a Benadryl, or something that is more sedating that they've used for other things before.
Trazodone, I want to say, is like a slight SSRI in a way to treat
Hmm.
both the depression or the sleep. Do you have any thoughts on? Because I finally had tried a couple of things like a benzo. I like had refused to do Ambien, but I tried a different Z drug. And then my psychiatrist was like, what about Seroquel? And I think for me, like a second generation atypical antipsychotic, like to me, the word antipsychotic, again, antidepressant, antipsychotic, like these are terrible, scary words. It's not technically what it's like. It's a mood stabilizer, right? But I was a little nervous about that. But it ended up being the thing that worked for me. So do you ever prescribe maybe like an antipsychotic for sleep purposes?
Yeah, and especially with Seroquel and breastfeeding, we have, more research on that one than some of the other medications, and it seems like it's secreted in a very small amount in the breast milk. So it's pretty similar to sertraline in terms of the relative infant dose. So yeah, that's definitely something that, we'll explore for some people.
All to say, if you're listening to this, it's very individually tailored to you, but work with someone who knows about the medications. Don't just assume you cannot take something because you're breastfeeding. Work with someone who knows the data, who knows what's safe or what not, and your history, and can find something that will work for you. Yeah. And then lastly, I think you have this passion also of talking about, the risk of untreated mental illness versus the risks of taking medication. And it's so important to convey the difference when it comes to postpartum mental health. I think there's still such a stigma and fear of psychiatric medications that run deep, particularly with our Asian American population. I don't know if maybe in Texas, like if you see this population as much, but like, have you noticed that it can be particularly hard to convey these risk benefits of medication and untreated illness to AAPI patients when you're considering medication for them?
I think I think also, here in Texas, we work a lot with Hispanic populations and in their culture too. I think there's a lot of stigma around mental health treatment. And yes, it's always hard to balance that discussion of risks of medication and risks of mental illness. And I think for me personally, I struggle with talking to people about what are the risks of their mental illness because it feels like that's not a choice necessarily that they get to make of having it. And then, of course, they're coming to me already having it. And so then I'm basically saying, here's the risk thing that you're exposing your baby to right now. But I do think that it's important to have that conversation, and it's important for people to understand that, we're not just giving medication out for no reason. Like, we obviously would not expose a person to medication, much less their developing fetus or their baby to the medication unless we really needed to, or unless there was some benefit for, doing that. But yeah, it can be a difficult thing to talk about and for people to hear too. I think everybody kind of naturally we focus on our fears, and our fear is taking the medication.
Yeah. I think there's probably listeners that are struggling to make that decision. And I think it really does boil down to finding the right provider who you trust and can have that conversation with. And I know for even some of the clients I work with, sometimes there's even that inherent stereotype, like because you're a woman, you're just anxious. And so it gets dismissed. And so, highly encourage folks, if you feel like you're not being taken seriously, find someone who will listen and will go through those fears and questions that you have. I think the rapport is core. Did not mean to make that rhyme, but is core to the therapeutic relationship with mental health providers. Dr. Lasseter, thank you so much for sharing your wisdom and for being a voice in this field. And we end all our episodes with a question of what you would tell your former self, maybe in the heat of your postpartum journey or in the heat of the long nights in residency, whichever place you can think of, in spirit of healing your inner tigress. What would you say to your former self?
As you're saying that, I realize that both those moments are probably very similar of the feeling of, oh no, this is never going to end, or this is
Mhm.
never going to get better, both in postpartum and in residency training. But yeah, so I think it would be something along the lines of the fact that this isn't going to last forever, and that things will get better, and that, it's worth just keep pushing through and getting through it, and standing up for yourself and finding something that works for you.
Medical training without being pregnant or having a child is already so hard. So I applaud you for entering motherhood while you were also in residency. I can't imagine that was very easy at all. And maybe part of the reason it was contributing to anxiety or depression, because it's two very hard things all at once. So bravo for making it out to the other side and, helping other women now through their journeys. I think that's so awesome. And love that you're one of the consultants on that PSI psychiatric consultation line. Doctors can call in to get some advice from that PSI line. And, PSI just does such great work, I think, around this. So thank you so much for your time. And where can our listeners find more of you if they want to, you have such great educational little blips and YouTube videos, where should we direct them to find more of your content?
I would say most of my content is on Instagram at the.reproductive.psychiatrist.
Okay, we will definitely link that in our show notes so people can find you. Thank you so much for your time today.
Thank you so much for having me. I've really enjoyed it.
We want to thank you deeply for tuning into this episode of Healing the Tigress. The more we share these stories, the more we can help our AAPI mothers and partners. If you enjoyed this episode and our mission, you can help us out in the following ways. Follow our show wherever you get your podcasts. Leave us a rating and/or a review, and share our podcast with a friend.
We also encourage you to follow us on Instagram at Healing the Tigress, where we hope to build a community of healing tigresses and give you updates on what's coming. And if you want more bonus episodes, please check out our show notes for how to subscribe to our exclusive content. Or you can also head over to our Buzzsprout page at healingthetigress.buzzsprout.com. We are not for profit. We are here to help our community, but any support you give us is so deeply appreciated. Above all, thank you from the bottom of our hearts for being here.
Healing the Tigress is produced and edited by Peggy and Jasmine.
Music for this show is remixed by Dr. Tony Huynh of Tony Mixes.
Our intro music is a cover of You and Me by Z Avi, played by our co-host Peggy.
Our outro music is a cover of Green Island Serenade, played by Jasmine's sister.
Cover art design is by Dr. Angela Chung.